Welcome to another deep dive. This time into AI and healthcare.
Yeah.
It's mind-blowing, really. This tech could totally change things, especially as the next billion enter the global economy.
Yeah, democratizing healthcare, right? Especially as tech becomes more and more widespread.
Exactly. It's crazy to think, I was reading, that it might actually one day almost be malpractice to not use AI in medicine. Like, could you imagine?
Wow.
And
Yep.
maybe, just maybe, your smartwatch will warn you about a heart attack before you even feel it coming on.
That would be incredible, wouldn't it, to have that kind of early warning system?
Totally. So we have an expert with us today who can help us navigate this whole wild world of AI in healthcare.
Well, thanks for having me. It really is such a fascinating field, and it's changing so rapidly, it's hard to keep up.
I know, right? I was just reading about how, right now, healthcare systems are mostly reactive, like treating diseases after they appear. But with AI, it could flip to being proactive, preventing them in the first place.
That's a key point. I mean, think about it. Right now, we're often playing catch-up. We wait for symptoms to appear, and then we react.
Right, like we're always one step behind.
Exactly. But AI has the potential to change that. Imagine a world where we can identify risks before they even become problems.
So let's get into specifics. How could AI actually, disrupt healthcare?
Well, diagnostics is a big one. AI is already making waves there.
Diagnostics, okay.
Yeah, think about analyzing medical images, x-rays, CT scans. AI can be trained to spot things a human might miss. It could mean faster, more accurate diagnoses.
Makes you think of this pathologist who was interviewed by Jack Adary, I think it was. He said he often overreads cancer on slides just to be safe,
Right.
and AI wouldn't have that bias, right?
Exactly. AI could remove that human element, which could be a good thing in that case. It could lead to better outcomes and even potentially lower costs.
Because you're not doing procedures you don't need.
Right, exactly.
That's incredible. But it's not just like static images, right?
Yeah.
AI can look at real-time data from wearables, too.
Oh, absolutely. Wearables are a whole other frontier. I mean, imagine your smartwatch. It's already tracking your heart rate, sleep, all that.
Yeah.
What if it could analyze that data and warn you about potential heart problems weeks, months even, before you even feel anything?
Okay, that's straight out of science fiction.
It might sound futuristic, but the pieces are already in place. We have the algorithms, the data. It's just a matter of putting it all together.
So, okay, this is all mind-blowing. Sounds like we're on the verge of a healthcare
I
revolution.
think so.
But what about doctors? Will they even have jobs in this AI-powered future?
The big question, right? Will AI replace doctors? It comes up all the time.
Yeah.
I think it's important to remember, though, AI is a tool. It's not about replacing humans.
So you're saying AI won't replace doctors, but their roles will change?
Precisely. AI will be a partner. Imagine having this super smart assistant by your side, helping analyze data, coming up with treatment plans.
Yeah, it would free them up for the more human side of things, right?
Yeah, exactly. Building relationships, explaining diagnoses, providing emotional support, all the things AI can't do.
That's good to hear. Makes it less scary.
Yeah.
So in this new world, this AI-assisted world, what do governments and regulators need to think about?
Well, safety's a big one, obviously. These AI systems need to be safe, effective, and fair. So regulations need to encourage innovation, but also protect patients.
Yeah, it's a tough balance.
It is like walking a tightrope. It's going to require governments, industry, healthcare providers all working together. We have to create a system where AI thrives but benefits everyone.
That's a great point. It makes me think, are some countries better positioned than others to jump on this whole AI healthcare revolution?
It's a good question. Countries with established healthcare systems might actually struggle more to integrate AI. It's kind of ironic.
Why?
Well, think about it. They already have these massive systems in place. It's hard to change those. But countries with less developed systems, they could just build it right in from the start.
It's like, remember how in Africa, cell phones took off before landlines ever really did?
Exactly. They just skipped a step. AI could do the same for healthcare. Imagine people in remote villages could get specialized care through their smartphones.
Wow, that's amazing.
Yeah.
Truly democratizing healthcare. Everyone has access, no matter where they are or how much money they have.
That's the goal. And AI makes it possible. It's really pretty incredible when you think about it.
It is. So we've talked about diagnosing existing conditions, but I want to talk about predicting problems before they even show up.
Predictive medicine. One of the most exciting and potentially transformative applications of AI in healthcare.
What would that even look like?
Well, picture this. Your smartwatch, which is already tracking everything, analyzes all that data and tells you, hey, you're at risk for a heart condition, even before you feel a thing.
That sounds wild, like having a crystal ball for your health.
It's not magic, though. It's just data and algorithms. AI can spot patterns we miss and use them to predict the future. It's powerful stuff.
That's wild. So
Yeah.
we could actually prevent problems instead of just reacting to them.
Exactly. That's the whole point of predictive medicine. Shift the focus from reaction to prevention. It can really change how long and how well we live.
Okay, but that brings up some, I don't know, tricky questions, right?
Oh, absolutely. Like, how do we deal with this information? What if someone's predicted to get something really serious, but there's no cure yet?
Yeah, and how do we make sure it's not misused, like by insurance companies?
Right, all those ethical considerations. It's something we have to talk about now before this technology gets even more advanced.
Yeah, before it's too late. Okay, so we've talked about democratizing healthcare, making it accessible to everyone.
Right.
But there's another side to that, right? The potential for AI to, like, disrupt the whole industry.
Yeah. We're talking about potentially changing the entire model of healthcare. It could be pretty unsettling for people working in the industry.
Some experts, I was reading about Peter Diamandis, he even said we could obliterate the current system, replace it with something entirely AI-driven. Is that even possible?
It's a bold vision, that's for sure. It won't happen overnight. But think about how inefficient things are now. Long wait times, crazy costs, everything's so fragmented.
It definitely feels like there's room for improvement, that's for sure.
And AI could streamline so much, automate tasks, free up healthcare providers to do the things that really require a human touch.
So doctors could spend more time with patients, less time on paperwork.
Exactly. AI could handle things like scheduling, managing records, even pre-screening patients to see how urgent their needs are.
Okay, that would be huge. And it could lead to a much more, I don't know, personalized approach, right?
Oh, absolutely. Imagine all your medical records, your genetics, your lifestyle, everything's in one place, accessible to you and your doctors.
Wow, that sounds amazing. But also kind of scary. What about data privacy?
Yeah, data privacy is absolutely paramount. It's sensitive information. These systems would need rock-solid security, and patients would have to be in control of their own data. That's non-negotiable.
So what should we be thinking about as we move towards this AI-powered future?
I think there are a few key priorities. First, making sure AI is developed and used in a way that's fair for everyone. We can't create a system where only the wealthy benefit.
Right, we don't want to make existing inequalities worse.
Second, prioritize data privacy. Like we said, that's critical. And finally, bring together experts from all different fields. This can't just be about tech. We need doctors, ethicists, social scientists, everyone.
So it's a complicated problem. A lot of different pieces to consider.
It is, but I think it's a challenge we can overcome. The potential benefits of AI in healthcare are just too big to ignore. We just have to be smart about it.
This has been eye-opening. I'm really starting to understand just how much potential there is here.
And we're just getting started. This is just the very beginning of the AI healthcare revolution.
It's exciting and a little bit scary, to be honest.
It is. But it's also an incredible opportunity. We can really shape the future of healthcare in a way that benefits all of humanity. That's the goal, anyway.
Speaking of shaping the future, I want to talk about this idea of a quote-unquote doctor in your pocket.
Ah, yes. AI-powered healthcare on your smartphone. It's a fascinating concept.
The potential to reach people in remote areas, people who don't have access to good health care, it's incredible.
It is. And there's already real progress happening in this area. Apps that can analyze symptoms, give basic advice, even connect you with a doctor remotely.
I read about this company, Orbis, I think it was. They're using AI to analyze retinal images. They can diagnose all kinds of things, brain disorders, metabolic diseases, all from a simple eye scan. It could reach millions of people.
That's a perfect example of AI leaping over those traditional barriers. And it's not just about diagnosing either. AI can help with personalized treatments, managing medication, all kinds of things.
There are platforms that use your genetics and your medical history to figure out the best medications for you. It could be a game changer for people with chronic conditions and prevent those bad reactions to medication.
The potential is huge. But of course, we can't forget about the challenges. Data privacy, making sure the algorithms aren't biased, making sure there's still a human element to all of this.
Right. We have to be careful not to create new problems while we're trying to solve old ones.
Exactly. It's about finding that balance. Embracing the potential of AI, but not being naive about the risks.
So where does that leave the traditional doctor? Do they become more like consultants guiding the AI and stepping in when needed?
That's the million-dollar question. It's something people are still debating. Some think AI will automate a lot of what doctors do now, and their role will change drastically. Others think the human element will always be essential, and AI will just enhance what they do.
I guess it's hard to say for sure. It'll probably be a gradual evolution, with AI taking on more and more over time.
Probably. But it's important to remember that technology is just one part of this. We can't forget about things like poverty, lack of education, access to healthy food. Those things have a huge impact on people's health.
Right. AI can't solve everything. It's not a magic wand.
Exactly. We need a more holistic approach. It's about using AI to empower individuals and communities, not to replace human connection and compassion.
So at the end of the day, it's about more than just living longer. It's about living better.
Well said. It's about giving people control over their own health, making sure the healthcare system is focused on the patient.
That's a vision worth working towards. I'm excited to see what happens in the next few years. This has been an incredible conversation.
It's been my pleasure. It's always great to talk to someone who's so engaged with this topic.
And to our listeners, thanks for joining us on this deep dive. We hope you're as excited as we are about the potential of AI to change healthcare for the better.
Absolutely.
It's really been quite a journey. All this talk about AI and healthcare, personalized diagnostics, even AI completely changing how healthcare systems work.
And we've just scratched the surface, really. The possibilities are, well, pretty mind-boggling.
I keep thinking about the impact on the next billion. Those folks entering the global economy. It's like they could skip over all the problems of, traditional healthcare.
Yeah, like that leapfrogging idea. Think about how in Africa, cell phones became widespread before landlines really took hold.
Right.
AI could be the same for healthcare. Imagine, people in remote areas, they could access cutting-edge technology no matter where they live or how much money they have.
It'd be like, I don't know, hitting the reset button on the whole system. Starting fresh.
Not exactly. A chance to build something better, more fair, more accessible.
Speaking of fair, we talked about AI making healthcare more honest.
Right, right.
Dr. Oz was talking about that, how AI could get rid of some of the financial biases that, sometimes happen in traditional medicine.
Yeah, it's an interesting idea. AI doesn't care about profits. It just looks at the data.
So it could be a more transparent way of doing things. Put the patient first.
Yeah, exactly. The patient's well-being is the priority, not the bottom line.
Of course, we can't get carried away. AI isn't, perfect. There's still bias in the data, privacy concerns, all that.
Absolutely. We need to make sure these systems are designed ethically, responsibly. But the potential benefits, I really believe they outweigh the risks.
I think so, too. Imagine your smartwatch telling you you're at risk for heart disease, or your phone analyzing your voice to see if you might be depressed.
It's like having a personal health guardian right there with you all the time.
It's about giving people control over their own health. They could get personalized insights that, used to only be available to a select few.
It's like democratizing medical knowledge.
This has been incredible. Thank you so much for sharing your expertise.
It's been my pleasure. Always great to discuss these ideas, especially with someone who's clearly so passionate about it.
And to our listeners, thanks for joining us for this deep dive. We hope you're as excited about the future of AI in healthcare as we are.
It's an exciting time, that's for sure.
And remember, the future isn't set in stone. We can shape it. So stay informed, stay engaged, and keep asking questions.
I couldn't agree more.
That's all for this episode of The Deep Dive. We'll see you next time. Keep exploring, keep learning, and keep pushing the boundaries.